All right, everybody, it is 2 o'clock, so let's go ahead and get started. And if anybody else joins later, that is perfectly fine. But as you should be able to see the agenda. So the purpose of today's meeting is to kind of review where we are in terms of the Safe Sleep Education presentation. We have some slides to review in addition to some scenarios, and then I also neglected to put this on the agenda, but also a pre and post test and some evaluation questions. So we have had 2 meetings in the past, but it's been a while. So I just want to start off the meeting by asking if anybody had a chance to review any of the documents that were attached to the event.
I did. This is Sandy.
Oh, awesome. Okay. Anybody else?
This is Dale. I did, but I don't know if I necessarily, because you and I were.
Yeah, we were talking separately. Okay, well, I guess. Yes. So we can kind of go through those, and then I guess I'll just ask Sandy, since you did review them, did you have any initial comments or questions that we could start off the discussion with?
No, I thought it was very well done.
Okay, awesome. All right.
Thanks, Sandy. I had a question for the group,
yes,
if I could. I understand kind of the overall goal there that we need to summarize again.
Dale, your sound's going in a little, going in and out a little bit. Can you repeat the question one more time?
Oh, I'm sorry. No, I'm just asking if there's anyone on the call who is not familiar with the project, had not attended a prior meeting, and or needs that 10,000-foot view of where we're going with this.
Yes, great question. Why don't you go ahead and give an overview just so that we can all get a recap?
Okay. Well, so the concept obviously is that sleep-related deaths are universally preventable, and they do account for such a large component of infant deaths in the state of Arizona, as proven by our data with the Child Fatality Review. The Arizona chapter of the American Academy of Pediatrics and other organizations have done really well at reaching out through the clinic environment, through the nurseries in the state of Arizona, but no one's really ever tackled education and disseminating safe sleep practices in the home. And there are a couple of states out there in the country that are doing that. So the mission here would be to not necessarily recreate the wheel, but to essentially create an avenue to educate first responders. Here, EMS is our focus with PACES, to essentially create a module that can be used for CE credit and be disseminated, and if approved ultimately through the EMS Council, put on the ADH website that we can share with all of our colleagues as kind of a support element to them, with the outcome being is that paramedics can interface with the community and help us disseminate safe sleep and prevent infant deaths. I guess that's the 10,000-foot view. What we're working towards with these tools is to essentially create a module that can be independent training. It could be classroom-based training. And again, a resource for people to be able to tailor it to use as they see fit in their own environment. The fact that it's electronic, I think, really helps us outreach to rural Arizona, as opposed to centralized classes that occur in, the larger populations. Julie, am I missing anything there?
No, that was great.
So what we're going to go through is that we have a PowerPoint presentation, and Julia, the lion's share of the work, Julia, thank you for doing this, was setting up some case scenarios. And I think you can envision everything from a classroom of 20 to 40 people going through the educational component through the PowerPoint, Q&A event afterwards, and then breakout small groups to walk through case scenarios and do some reenactments maybe, versus someone who's literally sitting in their office or their dining room at home and going through these simply electronically on their own. If we are able to disseminate this as a teach the teacher approach, we could do a course, and essentially everybody who goes through the session would be able to take it to their own communities and train and educate other people with it. In addition to the modules and the case scenarios, we have a pre-test and a post-test, because we want to be able to adjust and kind of quantify impact. But what I think is really valuable is to ask people to volunteer email contacts, and then we can do even 3-month and 6-month follow-ups and ask them, have you had an opportunity to share this knowledge with family members, with new parents, with with people you see in the community when you're doing maybe a scene call or something like that. So that's kind of the overview. I hope I didn't talk too much, Julia, there. And if you want to add anything, please do. Otherwise, let's go ahead and start reviewing, I guess.
Yeah, let's just dive right in really fast. Before we officially get started, I want to take a roll call. I see some names, but I also see some numbers that I'm not sure who has joined. So I see Anne, Dale, Gail, Jordana, Karen, Sandy, and Yomi. Who else is on the line?
Julia, this is Michael Allison. Thank you.
Oh, hi, Michael. Anyone else? Okay, thanks.
Julia, Heather Miller from Kingman's on as well. Sorry.
Oh, hi, Heather. No problem.
Thank you.
Okay. So let's start with the slides. Can kind of go through those really quickly. We can just kind of go through sorry, I think I lost my screen. I apologize. Okay, can everybody see the slides if you're using a laptop?
I can see it on my end.
I can see them.
Okay, great. All right, we can kind of go through these. If you have any questions or comments as we go through, then please speak up. Or if anybody has any initial comments based on any review that you've done beforehand, again, feel free to speak up. So I guess we can I'll just kind of scroll down. If anybody has a preference on how we do this, let me know. We also will have some logos on this. I took some off just for this so that we could just focus on the content. So we had kind of identified 5 learning objectives. Does anybody have any comments or questions on this slide?
I think they're comprehensive. I personally don't have more to add, but would welcome other opinion.
I think they're really clear and easy for the learners to understand.
Okay, thank you. Okay, we'll go ahead and go on to the next slide.
Julie, I'm just thinking about our best interests of time.
Yeah.
This slide set was sent to everybody. Has it, right?
Yes.
Does the group want to go through these slides individually, or do you want us to kind of scroll through and if you haven't looked at them yet, maybe at your own convenience, comment later, or please tell us how you want to go through these. We don't want to waste a lot of your time if you don't need a full review of them, I guess is what I'm saying.
I'm fine with either way. Yeah, I don't want to waste anybody's time either. So if you would rather look at the slides at a later time and provide feedback, that's totally fine. But we can also go through them one by one. So it's up to the group to decide.
Yeah, the slide set starts with kind of some background information, talks about the child fatality review and the data that we've shown in Arizona. And really, I think focuses on some of the bullet points, some of the real punchlines, that we can talk about. We give background information on SUIDs and SIDS so people understand that definition and how those are defined. And I think I like this line here. Well, I don't like it, but I think it's valuable. In Arizona, a baby suffocates while sleeping every 5 days. That's pretty remarkable. That's a good take-home point. Again, some of the bullet percent points that I think really catches your attention. And I like the way preventable was in red. Really emphasizes the fact that we can have an impact here.
So then we kind of go into the two aspects. One would be the unsafe sleep environment. So we list these 4 points and go into depth there. Okay, then the safe sleep environment.
Julia, back to that slide. That may be worthwhile kind of breaking into 2 slides. It's just a lot of text for a single slide.
Sure.
I would also add that at the beginning of this, you had an unsafe sleep environment, and you had the picture with the baby with the blanket, the hat, and the. So I would maybe change that one right there that you just scrolled past to the proper safe sleep.
Okay. Yes. Add photos.
Yeah.
Can I comment on the very first one? The very first slide I was waiting to see, the baby is on its belly instead of on its back. And if we're talking about what it should look like, yeah, that one. We should probably use the right picture for that as well.
Okay, yeah, I think I just chose that because it's about
It's cute.
Sleep, so it could be.
Oh, okay.
Either. But yeah, that's a fine. That makes sense to me.
Yeah, I would just change that one to the right one.
Thank you. Okay, so divide this into 2 slides, and then we have to add photos. Again, we can add photos here as well. And did you say that you had some photos that we might be able to use?
Yes, I can send them to you.
That would be awesome. Thanks. Okay, so after the safe sleep environment, we just go into the role of an EMS provider, and this is pretty general. But we have these 3 points. We can change this photo again. It was just a cute photo, I guess. It's kind of hard to find specific photos that aren't like copyrighted or, you know.
Yeah, we had to purchase ones that showed the correct safe sleep environment.
I was trying to use some free platforms that I'm aware of, but of course there's limitations with that.
And if we also need to get permission, or if you want us to put the acknowledgement as Arizona AP being the contributor, just let us know how we should do that.
Great, thank you.
Yeah, no, thank you.
Okay, I linked to this. I linked to this checklist as an already existing resource.
Great, thank you.
Okay. Okay, and then this is where the different scenarios would could be used. We'll go to that in a minute. Okay, and then these are just some resources at the end. Okay, does anybody have any comments or feel like there are gaps or missing information based on the slides that we just reviewed?
The phrase bed sharing may be clearer than co-bedding.
Okay.
Are there any teaching notes in any of the slides?
Yes, I couldn't, didn't get them into this document, but there are some notes that expand a little bit on that in the notes section.
Excellent, thank you.
I can send that out in a PowerPoint form, this out in a PowerPoint form after if people would like. Okay, if there are no comments for right now with this, we can go on to the scenarios. And then, of course, if you are looking at these later and have comments or questions, please reach out. Okay. Okay, so then in addition to the slides, Dale and I were thinking it might be good to have some scenarios, and then I just kind of added a little bit more information here, so it's like a toolkit edition. But these are straight from, I think these are from the DCS website, but some just from tips for talking to parents and caregivers, and then just talking about promoting key messages, and then we have different scenarios.
Julia, can you make that a bit bigger, please?
Yes.
Thank you.
Okay, so let's go through these one by one and discuss if they're worded correctly or if you have any thoughts on how somebody might actually enact it out and what they would learn from it. But so scenario 1, you are called on scene to check on an elderly patient in a home. After treatment, the patient is stabilized and does not require transport. You notice the baby is sleeping in an adult bed with pillows around him. Based on what you learned in the safe sleep presentation, what is wrong with the scenario and what might you say to the caregiver?
So my thought was, with a toolkit, this could be maybe a single page as almost like a little flyer.
Oh,
that-
yes.
that you can hand to a small group and say, okay, you guys go in that corner and you work through this scenario. So the scenario would be on the page, including, if Julie, if you scroll up, that the tips for talking to parents, and then maybe like an image that kind of captures the visual that we're trying to show. And then that would be the toolkit. Again, you know, the benefit being is that someone could print it and actually hand it out to a small group and say, okay, you guys will work on this. And then bring it back to the group and then discuss.
Yeah, I liked that idea. I saw that you commented on it. I just put them on one page for this purpose of this, looking at them. But I think that's a good idea. So that we can kind of, if somebody in a classroom setting wanted to give each group a different scenario or something like that, then that would be easily doable. Any other thoughts on how the scenarios might be used or on this specific one?
Julia, this is Michael.
Yes.
Do you anticipate any tribal-specific training, or would tribal representatives or EMS just join in larger groups?
I think that we were imagining this as a more general training that any group would be able to pick up. And so we aren't necessarily conducting the training. It will be more as a resource on the website so that an agency could pick it up and do it themselves. With that said, if you had ideas for like a specific scenario or specific things that needed to be incorporated and felt like it would be useful to incorporate that, then I think that would definitely be something to discuss.
Yeah, I was just thinking from a tribal perspective, you know, probably all of you know that Native people in all the cultures have cradle boards. So babies were never put on their bellies, you know, they were always in the cradle board. And a lot of stories around, you know, how those are made and the importance of them. Also that maybe all you know that within the tribal communities, they have community health workers, CHRs. Their counterpart would be like the community health workers, the promotores. And while I was going through the slides, I was thinking that they probably already have something very similar that they've already developed, you know, and they already probably have tribal specific visuals that go with their training. And they're the actual ones that go into the houses and the families. So I think in the end, in working with the tribal EMS personnel, that's probably what they're going to say, is that if there's outreach to the tribes, then it makes sense to involve the community health representatives. So anyway, that was my thought process. So thought I'd ask the question, make the comment. Thank you.
Yeah, thank you. Yomi or Ann, do you know if there's anything that already exists with community health workers specifically for safe sleep?
I don't know as far as community health workers, but I know that there are home visiting programs that do incorporate some of this education that's being learned at the home, which is probably very similar to what Michael's addressing. And it is one of the things that they do look at. I know they have it up in Apache, up in Navajo counties. And I know Coconino does do some training up in of that. And we do provide pack and plays to a lot of those county health departments. But we also work with some of the tribes as well on the injury side. So like within San Carlos, the Supai, Havasupai. So I'm sure that there is organization, not necessarily EMS, but for sure some of the home visiting and some of the tribal injury partners.
Okay.
Julia, this is Gail. I think to Michael's point, that might be something to at least add a slide or two about some specific considerations to include.
Okay.
I would agree with Gail, just because you just never know, and you want to be sensitive to that as well, just in case they do pick it up and they have that information.
Okay, so Michael, I might ask you later if you would be able to assist me with that, like a slide or two.
Sure, we'll be happy to. Thank you.
Thanks.
Julia, this is Gail. My other question, I don't know if everyone on the PACES committee has seen the Bureau of EMS and Trauma Systems education page, so where we typically house educational curriculums. The Education Curriculum Committee has put together several training PowerPoints, and we have them on a cycle where we make sure we review and update them as necessary every 2 to 3 years. And so those are on the Bureau's website. So I'm not sure if everyone in the PACES group is familiar with that, but just for an awareness of where we would house this from an EMS perspective.
Sure. So thanks for bringing that up. I am showing the screen where on the Bureau of EMS website, other trainings are posted, and this would also be where this training is posted, as assuming everything gets approved by all of the different committees.
And typically when we do have a new educational curriculum, we always like to send that messaging out to as many different EMS organizations in the regions just to help spread the message that these are available. And any EMS agency can download the educational curriculum and then administer that to their EMS agency.
Thank you.
Julia, can you go back to the paper that you were just showing that had the scenarios on it? Yeah. As Dr. Woolridge was talking about, we envision the EMS providers breaking out and where it says practice with a colleague, refer to the tips above. However you decide to lay this out when it gets distributed to them, we might want to include on that form the safe sleep practices. so they can refer back up to that and talk about things a little bit more in detail that say, remember that bed sharing includes not sharing a bed with siblings, so that they can look at that when they're role playing and practicing with each other about specific things that they might want to say to the families, to kind of have those right there on the sheet that they have in their hand while they're doing that practicing with each other.
Okay, awesome.
Kind of remind them what they just learned in the presentation.
Julie, this is Sandy. I just have a question. Whether some of the people on the phone know, do the L&D, Departments Labor and Delivery, do they have this type of presentation to the new parents while they're in the hospital?
So they don't, this is Yomi from ADHS, and though they don't have this type of presentation, they do provide crib cards that were developed and paid for through Title V, and they're drop shipped directly to their facilities. And what they use it for is kind of like they use it as an education tool to be able to discuss with the family what safe sleep looks like while they're in the facility. And hopefully that gets the ball rolling as far as they should be doing it in the hospital, but then also when they go home. So they started off, most of the time they don't get it necessarily in labor and delivery, but they get it in postpartum. So that when the postpartum nurse is having the educational, so there's several things they have to be able to do before they go home. And that's one of the components. So talking about what safe sleep looks like in the facility, and then once they go home. The intent with the Bassinet Safe Sleep card is that when they go home, they're supposed to, it's kind of a momentum, so they can write their name, the date of birth, and who the physician was that delivered them, the baby, so that they can put it up wherever that baby is sleeping in their sleeping environment at home, so that if there's an additional caretaker that comes, so if grandma, aunt, whoever's watching the baby in their sleeping environment, that they're going to practice the same sleeping habits that that mom and dad or whoever has that baby is going to do there at home as well.
And this is Anne from ACAP. Our sleep suffocation campaign that this curriculum was built around, we have a module that's coming out that is designed for hospitals that our committee is reaching out to and hoping to engage the hospitals in. And it is designed to go hand in hand with everything Yomi was just talking about, so that they are using the suffocation language and then talking to them about utilizing all the ABC materials.
Thank you.
Okay. Thanks for that information, Yomi and Ian. So the second scenario here, you are called to a scene for an infant choking event. The child recovers and appears well by the time you arrive at the scene, but you find out the baby was placed on the couch to sleep. You see a bassinet in the corner, but it's full of laundry and looks unused. Again, based on what you learned, what's wrong with the scenario, and what might you say to the caregiver? And again, we'll have these on separate pages with maybe an image or something along those lines, and then include what a safe sleeping environment looks like, so that they can incorporate that into their discussion.
I think these are great examples.
Thanks.
This is Dale. I really appreciated comments earlier about that it's not necessarily always a paramedic or a firefighter who steps into a house. I know we're doing this through PACES and EMS Council, so it's kind of written towards the EMS personnel, but I'm almost wondering if we should, if it's applicable to other personnel who may be in the first responder role, or should we make it more generic so it can be applied to a variety of audience? I don't know. I just kind of mulling that over since the last comment. I'm wondering if the group feels strongly one way or another.
This is Michael. I like that comment and suggestion.
Yeah.
So do you think there are specific places on the slides that would need to be expanded, or just maybe incorporate more scenarios? Or
Well, like scenario number 3, called to the scene for presyncope, third trimester. It's got the medical lingo to it that if you're not medical, you probably wouldn't be appreciated, or at least be less able to role play. So maybe, but I don't want to lose value for our EMS people either. But you know, maybe not be so heavily medical, and then it can be applied to someone who is maybe not necessarily fully medical. Like here, female fully recovered, and we originally had vital signs were stable, but I pulled that out. So I mean, I think it's applicable. I guess I wanted insights from the group.
This is Gail. Maybe an option, if we want to make it more applicable to different groups, would be to have different scenarios where we have kind of similar scenarios, but maybe change so it's more kind of relevant for different groups. So one that's more EMS specific, other for first responders, and maybe non-healthcare workers.
Yeah.
Yeah, I would agree with that.
Okay.
Yeah, maybe the same scenarios, but just have like copy this onto a different page, change it a little bit, and then just market it as different audiences.
Yes, that would be great.
Yeah, that wouldn't be a lot of labor. I think that would be.
Oh, that would be pretty easy.
Yeah. Thank you.
Okay. Last 2 scenarios. And then Dale, you said the last one would be more just for law enforcement.
In full disclosure to the group, I chair a child fatality review down here in Tucson, and I'm also an advocacy center director. So we interface with law enforcement and the medical examiner's office in both those roles that I have. So it's a particular interest of mine to be able to reach towards law enforcement too. But I really appreciate Gail's comment about how we can divide these out. But if you look at scenario number 5, I don't know if it necessarily applies to EMS. That's why we put in parentheses law enforcement. So, but we can subdivide that based upon our audience. I think that's a great idea, and we'll remove this one. If you read it, I think you probably all agree. If you will remove it from the EMS category. Because I don't, you know, EMS is not necessarily involved with scene investigation nearly as much as law enforcement. So.
Okay. Okay. Any other comments about the scenarios?
I think you've done a really good job of really driving home the point that we were trying to make, that you don't have to be there for a sleep-related or even child-related call. I think you've done a really good job of creating very different scenarios that just say, if you're in a home and there's an infant there, look for that opportunity just take a look around and look for that opportunity to talk to families about safe sleep practices. So I think you've done a really good job of creating different scenarios that just put that in their heads, that any opportunity is an opportunity to talk to the families about it.
Yeah, I agree. I want to thank Dale for most the ideas behind these. Awesome. Any other comments? Okay. So then at the bottom of this, and again, this can just be a separate document. I don't know. I thought maybe some frequently asked questions might be good. These are just some ideas. But if you can think of other ones that are relevant, then we can definitely incorporate that. Also, the resources available. I'm not an expert on this, but Yomi or Anne, I'm sure both of you know much more of what's available. We could potentially include there.
Yeah, we can kind of go over that. So CRITS for Kids is the national office. As far as for Arizona, there's not a central hub resource.
Okay.
It's we can talk about that.
Okay, sounds good. Okay, and then I just kind of copied, this is the safe sleep checklist that's identical to the one that I had already shown you. So we could also just include a copy of that checklist as a resource. Okay, any other comments on this document?
This is Michael. I just wanted to echo the comment earlier that everyone did a really nice job on the PowerPoint and presentations. Very critical, because when I was looking at it, I was reflecting back when I first got married and started raising a family. These would have been good information for me to know to be a better father, taking care of our babies. So good job. I think it's still it's always going to be relevant, this type of information. And unfortunately, this type of information doesn't necessarily reach all our families that, need to be reached. So good job. Thank you.
Thanks, Michael. Okay. So then the last document for review that we had today was a draft pre and post test that could be used for CE. So these are just questions based on the PowerPoint slides. If you want to, let's see. Any thoughts about the pre-test, the post-test, exactly the same?
I don't know what the requirements are for CEs for EMS providers. I'm assuming we've gone over these with, forgive me, I've forgotten his name, the person who who leads the education for the EMS providers. For CME, for physicians, there's very specific ways that the questions can be written and the way that the options can be provided for it to qualify. So we may have to have him look at that. And
yeah, that's a really good point. I did not do that. So I don't know if Gail, you have any insight about that, but yeah, we can give it to Doug or somebody to review.
Yeah, no, I'm sorry, Gail, if I interrupted. my interest was to draft this up and then see if we can hit the chair of the education committee and get kind of those preliminary advice before we submit it forward. Gayla, do you think that's the appropriate steps?
Yes, Amber Rice is the chair of the education committee, so I'm sure she could review this. In terms of EMS CEs, it's much more casual in comparison to kind of physician CME, so there isn't any specific format. Really, the goal is just to make sure that you can identify that someone has actually participated in the time that you are giving them credit hours for. So part of doing a pre and post test, it helps to show that they've actually done something before the education, taken the education, and hopefully learned something. So not a specific requirement. This is actually more in depth than what we typically put together.
Fantastic.
Yeah, and I can. Amber is one of my colleagues down here in Tucson, so I can catch her and get some early insights for the group.
And then I would just add to make sure that we have a question that relates to every one of the learning objectives that we put at the beginning.
Okay, thank you. Okay, and then lastly, these are questions that Dale had put together. Well, these are just evaluation questions, I guess. Sorry, first. Course evaluation questions, just asking if they learned anything. And then these are questions that Dale put together for a follow-up survey. As he mentioned earlier, hopefully we would be able to get the names of participants and then follow up with them later to see if they were able to use the information that they learned.
My goal here was to try to address, engage retention, but also utility. You know, our EMS agents doing this in the field. If in the pre and post, we had an optional fill-in blank for them to put in their email. If the individual class attendee does not want to be contacted, then they could opt out by not entering their email address. The hope is that they would be willing to be contacted as follow-up.
I'm not sure how any of the other ones work if we collect the people that participated, but we could also request potentially that trainers would send rosters in with contact information and see if that would be another way to get something like this out. I'm not sure if that's if they do that or not. But any comments about this or questions? Okay. Well, if there's no further comments on this, does anybody have anything else that they would like to look over one more time, or any comments on something that we didn't get to talk about earlier? If not, what we can do is I'll just go ahead and make any of the changes that we discussed today, send out notes to the group, as well as another draft of all of these materials so that we can all have them just to review again before sending on for review by Dr. Rice. And then we can move forward from there.
Yeah. Our hope is to maybe expedite a little bit in that we ultimately need education approval and EMS Council approval. And Gail, correct me if I'm getting the process wrong. But if we do that in a timely manner, I think we're still looking towards when is the next EMSC? I don't think we're going to make it until in this calendar year. So if we escalate that and not necessarily have another sit-down meeting and maybe have electronic approval from everybody, we can get this over to the Education Committee faster. And I think that's what Julie is alluding to. Does that work for everybody?
We just have to make. So I recently watched a fun video on open meeting rules and all of that. We just have to make sure that we're following all of those kind of guidelines when we get things approved. So we'll have to make sure that whatever we do, for example, Dale, I know that we had discussed potentially doing like an email approval type thing. I don't think that that's going to be able to work unless we can somehow get around open meeting law. But potentially if we asked very nicely of people, maybe we could have a special meeting. I'm not sure. But
gotcha.
Yeah.
Okay.
Yeah.
Well, yeah, whatever constraints we have. So.
Yeah, but I can definitely move quickly in getting these documents back out to the group so that we can at the very least have these finished on our end, and then move forward from there. Does anybody else have anything to add? Okay. Well, thank you all for participating. This was a good meeting. I apologize for the delay in meetings. I know everyone's been kind of busy and everything's crazy for everyone right now. But thanks for joining, and I think this will be a great training when it's all finished. If you have any other ideas or comments or questions or anything, feel free to reach out via email or phone. I am available. Yeah, if nobody else has anything, we can go ahead and close the meeting. Any last comments?
Thank you, Julia. Well done.
Yes, thank you for all your hard work.
Thanks, everybody. All right. Have a great rest of your day.
You too. Thank you.
Thank you, everybody. Julia, thank you